Indian Journal of Anaesthesia. I, Dr. Iniki Sharma, will be presenting an article published in the May 2025 issue of the Indian Journal of Anaesthesia. It is titled Quality of Recovery QOR 15 Following Opioid Free versus Opioid Anesthesia for Elective Endoscopic Nasal Surgeries, a randomized open label comparative trial. Opioid analgesics are widely used perioperatively due to their effectiveness in suppressing sympathetic responses and postoperative analgesia. However, high dose of opioids in ambulatory surgery can cause adverse effects such as respiratory depression, GI issues, hyperalgesia, immune modulation, and delayed recovery. Opioid-free anesthesia, which combines non-opioid analgesics, regional anesthesia techniques, and adjuncts to manage pain while minimizing opioid-related risk. So this study aimed to compare the QOR 15 scores between opioid-free anesthesia and opioid anesthesia in nasal endoscopic surgeries. So the primary outcome was the QOR 15 scores between the two groups. The secondary objectives were intraoperative hemodynamics, postoperative complications, functional activity, sedation levels, postoperative analgesic requirement over 24 hours, and length of stay in the post-anesthesia care unit. The Institutional Ethical Committee approval was taken and trial was registered in CTRI. It was a randomized controlled trial including patients ASA grade 1 to 2, 18 to 60 years of age for elective endoscopic nasal surgery. Patients who were hypersensitive to local anesthetics, alcohol or drug abusers, neurological, psychiatric, cardiovascular, or patients with respiratory disease or opioid use within the last 24 hours of surgery were excluded from the study. A pre-validated QOR 15 questionnaire was given to all patients in the PAC area on the day of surgery. All patients received 10 to 15 ml per kg of RL, glycopyrrolate, MCET, and midazolam preoperatively. In the preoperative area, they were randomized into two groups using simple random sampling. The OA group, where opioid analgesia was given, and OFA group, where opioid-free analgesia was used. For the OA group, all patients received fentanyl 1 mg per kg and dexamethasone 8 mg in pre-medication, whereas in the opioid-free group, lignocaine 1.5 mg per kg IV was given with paracetamol 15 mg per kg, dexamethasone 8 mg, magnesium sulfate 20 mg per kg, and dexmedetomidine 1 mg per kg over 10 minutes. For maintenance, in the opioid-based group, fentanyl was used for 0.2 to 0.7 mics per kg per hour till 10 minutes before the end of surgery, whereas in opioid-free group, dexmedetomidine was used at the same dose till 10 minutes before the end of surgery. Anesthesia was induced with propofol and patients were intubated with scoline. Maintenance was with oxygen, nitrous oxide, and sevoflurane. After the patients were reversed and extubated and shifted to the PACU, the pain was assessed, and if NRS was found to be more than 4, IV paracetamol 1 gram rescue dose was given. The duration to first rescue analgesia was noted. The QOR 15 questionnaire was repeated at 24 hours after surgery in the postoperative period. So the primary outcome was the QOR 15 scores between the two groups. The secondary outcome was intraoperative hemodynamics, postoperative complications, functional activity, sedation levels, postoperative analgesic requirement over 24 hours, and length of stay in the PACU. From a previous study, sample size was calculated at 80% power and type 1 error of 5% at 32 per group. And considering a dropout of 10%, it came out to be 35 per group. So this is the consort diagram where we can see that after assessing 70 patients for eligibility, 32 patients per group were analyzed at the end. This is a table showing the baseline characteristics between the two groups. Now coming to the primary outcome, which is the QOR 15 scores at the postoperative period between the two groups, we can see that the opioid-free group had significantly higher QOR 15 scores than the opioid-based group. In the secondary outcomes, the vitals at 30 minutes and 60 minutes were significantly, the heart rate was significantly lower for the opioid-free group than the opioid-based group. Similarly, the time until post-operative mobilization was significantly lower for the opioid-free analgesia group than the opioid-based group. The sedation levels were higher in the opioid-free analgesia groups. The mean heart rate over time and the SBP, systolic blood group over time between the two groups did not differ significantly. So, opioid-free analgesia improved the post-operative recovery compared to opioid-based analgesia in elective nasal surgeries with higher QOR 15 scores, better hemodynamics, lower pain, and faster mobilization. The multimodal OFA regimen reduced the opioid-related side effects like sedation, pruritus, and respiratory depression. Previous studies support the opioid-free analgesia benefits with better recovery scores, reduced PONB, and lower opioid use. OFA offered better hemodynamic stability, alertness post-extubation, likely due to dexmedetomidine and lignocaine's anti-inflammatory and analgesic effects. So this study's strength include a prospective design and use of QOR 15 scores. However, limitations include small sample size, single center setting, and a short follow-up. So from this study, opioid-free analgesia in elective endoscopic nasal surgeries under general anesthesia improved the QOR 15 scores, hemodynamic stability, pain control, nausea, vomiting, and early mobilization compared to opioid-based analgesia. Thank you.